Hi there, my name is Brandy Richmond. I am a nursing student with Concord, Jacksonville. This morning I will be performing a respiratory assessment. This will include the upper and lower respiratory tracts. The upper respiratory tract includes the nose, sinuses, pharynx, which are divided into the nasopharynx, oropharynx, and the laryngeopharynx. The nasopharynx consists of eustachian tubes. The larynx is often commonly called the voice box. It also includes the glottis. And finally, the epiglottis, which is located at the top of the larynx. The lower respiratory tract includes the trachea, main stem bronchi, bronchioles, alveolar ducts, alveoli, and lungs. Hi, my name is Brandy. I'm a nursing student with Jacksonville Concord. Could you please say your name and date of birth for me?
Austin Nelson, April 5th, 2004.
Okay, nice to meet you, Austin. Today I've been asked to examine your chest. This will involve looking and feeling different parts of your chest and your body while listening with my stethoscope. Will that be okay?
Yes.
Okay, are you currently in any pain?
No.
No. Do you have any questions for me before we begin this exam? No. Okay. At the beginning of the assessment, I will be examining the overall level of consciousness, agitation, anxiety, speech, skin color, exercise tolerance, and body positioning of the patient. Okay, Mr. Austin, I'm going to ask you a couple of history questions just to kind of get to know you a little better and try to figure out what's going on today, okay? All right. Do you know why you come in today? Breathing problems with marching band, okay. Has this ever happened to you before? No? Do you have any chest in your pain while you're breathing? No? Okay. Do you have a cough? No? Okay. Goodness. So you say you don't have any cough at all, nothing? No? Okay. Are you ever short of breath any other times? Like when you're walking to class or you're sitting playing video games or doing chores for your mom or your dad? No? Do you have any problems breathing at night?
No.
No? Do you have any allergies?
No.
No. Do you smoke or have you ever smoked, or including a vape pen?
No.
No? Does anyone in your home smoke?
No.
No. Okay. Do you know if anyone in your family has a personal history of asthma, lung cancer, eczema?
No.
No. Do you travel often with your family, like going on family vacations?
No.
No. Okay. Can you tell me where you currently live?
I live at my parents' house.
Where's your parents' house? Okay. Can you tell me today's date?
The 14th of June.
Perfect. And can you tell me who our current president is? Trump. Very good, very good. All right, let's see here. I'm just going to make sure there wasn't any questions that I missed for you while we're assessing. By assessing the patient's history, I've got a better knowledge and understanding of the respiratory complications that may be occurring. All right, great job with the questionnaire here, Austin. Now I'm going to ask you to do a couple of things for me. At first, can you please bring your hands up like this? Nice and steady. Okay. All right, can you turn them over? Good, good. Okay, you can let them rest back down for me. And then I'm also just going to do a quick look over, okay? So I'm going to get kind of close and up in your area. Is that okay? Okay. Look at me. Good job. Okay. All right, can you bring your two fingernails together like this and hold them? Okay. Good job. Let's see. All right, can you go ahead and put those down for me? Can you bring your arms back up so I can just check your temperature? I'm going to touch your hands and arms. It may be a little cold, okay? Okay. Oh, goodness, you're nice and warm. All right, you can put those back down for me. Now I'm going to come back over and I'm going to check for your radial pulse in your hand. It'll be right here, so just hold your hand up for me while I help you right here. Okay. While assessing his respiratory rate, it was normal, which is in the range of 12 to 20. All right, so now can I get you to lift up your head for me? Look straight at me. All right, can I get you to turn your head and just turn to the right? Very good. All right, and then look back forward. And then can I get you to turn to the left? Great job. While assessing the patient, when I was looking forward, I noticed that there was no flare, no nasal flaring, pursed lips, mouth to nose breathing, or evidence of any trauma. All right, so for this next part, I'm gonna need to take a closer look at your chest. So I'm gonna step outside and you please remove your shirt for me and then I'll come right back in, okay? All right, thank you. It's just Nurse Brandy. Okay. All right, so now I'm just going to be looking and checking over your chest. I'm going to be looking for any kind of scars. Have you ever had any surgeries or anything done before? No? Okay. All right. All right, now I'm going to check your trachea.
What is that?
Your trachea is a tube-like portion of your upper respiratory tract that connects with your larynx or your voice box. Your trachea you generally call your windpipe, okay? All right. All right, so I'm going to just get you to look forward for me. So it's going to be cold hands, cold hands. Good job. All right, so next I'm going to be checking for your chest expansion. This is what I'm going to need you to do is I'm going to need you to sit forward. It's going to involve me placing my hands around your chest and squeezing quite tightly, and I'm going to ask you to take a deep breath in, okay? All right. So just lean forward, that's okay. No problem. All right. Take a deep breath in and out. Breath in, breath out. Good job. All right, so now I can get you to scoot forward just a little bit on the edge of the bed. I'm just going to do the same process. I'm going to do it around your back, okay? All right. So, this is difficult here. Don't want to step on this side. It's a little bit easier. All right. And take a deep breath in and out. In and out. Great job, great job. Okay. Now I'm going to check some areas on your chest. This is known as percussion. I'm just going to be tapping slightly so you may feel some cold hands. Is that okay? All right. Goodness, I'm so sorry. Also going to do the same thing on the back, okay? We feel a little cold. Okay. All right. While performing percussion, the patient resonating normal, usual sounds, which were hollow. If there was any dullness heard, it would be medium intensity with a pitch. Consolidation would be present. For a tympanic pinch, I would be hearing a high-pitched sound that would notate those noises. Okay. All right. Now I'm just going to use my stethoscope here. I'm going to ask you to take some deep breaths for me, okay? All right. Maybe a little cold. And in and out. in and out. And in and out. All right, and just lift your arm just a little. It's gonna be a little cold. And in and out. Very good. And in and out. Okay, I'm also going to check on the back here. A little cold. And in and out. 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 Good job. Okay, so you can go ahead and sit on back and you can put your shirt back on if you'd like. All right. So should I expect to sit? I don't want you to hold your feet up for me. Let me know if you have any tenderness or pain whenever I touch you here, okay? No pain? Any pain here? No? Okay. All right. Well, thank you very much today, Mr. Austin. Everything seems to be okay. I'm going to give this notations to the provider, and then they should be in with you shortly, okay? So thank you. Hope you have a great day. Upon assessment of Austin, he had a normal symmetrical percussion note on the front and back of the chest. Abnormal sounds would have been a dull note, medium in intensity and pitch. Tympanic would have been high in intensity and in pitch, or a flat, which would have been deep in intensity and in pitch. Upon auscultation, he had a normal vesicular breathing with no added sounds. Abnormal would have been bronchiovascular, which would have been medium in pitch upon inspiration. Expiration. Expiratory, which would have been longer in length. The pitch would have been medium as well. Bronchial, which would have been a high pitch, or a tracheal, which would have been a louder high pitched sound. We had the information of his pulse oximetry, which was at 99%, which is in the normal range of 95 to 100. His labs, for the PaCO2 was 80, which was normal, which is 75 between 100. His PaCO2 was 40, which is normal range between 38 and 42. His pH was 7.4, which is normal, which is 7.38 between 7.42. His HCO3 was 26, normal range would have been 21 through 28. His D-dimer was less than 50 at 25, which is also normal. The provider has ordered a septum sample, and that would complete his respiratory assessment.